Here, right? Okay.
Yeah, you're
Yeah.
going live.
Namaste, good afternoon. Welcome to the Recover series presented by Apollo Hospitals. This is Dr. Srinidhi Chidambaram. I do hope that in your part of the country, COVID-19 cases are now declining, and let us hope that it stays that way and we can all get back to normal life once again very soon. The Recover series from Apollo Hospitals comes to you twice a week, and we bring to you the most important and helpful information for those who have had COVID-19 and for their families to recover, heal, and regain their health and well-being. One thing that stays with us before and after a COVID-19 infection is the emotional trauma that this disease causes. We try our best not to get infected, and while we do so, that is also a time of great fear, paranoia, and anxiety in us. What if I get it? What if others at home get it? Will we survive? That is a major stressor. And then once you get COVID 19, the isolation, the fear that it might become severe in just a matter of days, the fear of hospitalization, the fear of dying is also a major stressor. The post COVID period is also a time when people feel low, tired, depressed, irritable, and also are so worried when they will recover completely. And for those who have lost a loved one, there is an insurmountable amount of grief as well. Even those not infected who are at home often get into mental health issues because there's lockdown, there's social isolation, there's loneliness, and there's fear. Therefore, the mental health issues go across age groups, and all stages of the pandemic do cause an impact on one's mental health. And we can benefit a lot by acknowledging this and trying to figure out how this can be addressed safely. To help us with this and talk to us about the entire spectrum of mental health disorders, with particular attention to the post COVID scenario, we have with us Dr. Kirti Pai, who is a renowned clinical psychologist from Apollo Hospitals, Chennai. Dr. Kirti did her MPhil in clinical psychology from the Kasturba Medical College and PhD in CBT from the Madras University. She's been a consultant in Apollo Hospitals over the last 12 years and is also a mental health advisor to Apollo's school health program, which is called Apollo Shine. She's the Joint Secretary of the Tamil Nadu Association of Clinical Psychologists. She has completed training in grief therapy from the David Kessler University, USA, and a qualified professional supervisor from ACA Australia, has been working with adults, adolescents, and children on emotional, academic issues, other relationships, psychological, and cognitive issues. Welcome, Dr. Kirti, to our COVID Recover series. It's great to have you here with us. And I do hope that you can throw light on how best can we all manage the mental health aspects of this pandemic.
Thank you, Dr. Srinidhi. It's always a pleasure to be giving a talk like this, which inspires everyone. And as you said, this is a phase, right, from 2020 onwards. This is a phase of uncertainty and panic and anxieties, not just in one part of the world. It's a pandemic. So all over the world, everyone is facing this kind of anxieties and paranoia and the panic which you just mentioned. So we do have a lot of studies, like recently Lancet has published a study where they saw that over the world, about 50% of increase in mental health issues, and that's a big number. So we do have mental health issues which has been over the rise, and in the past 1.5 years, there is a significant increase, almost like 50%, which is a huge number. And that's the reason why mental health has to be discussed. People have to understand that there is no stigma on discussing mental health. People have to talk about it. People have to take care of their own psychological well-being. Because in India, we live in a nuclear family, and there are still people who live in joint families. So it's very essential and mandatory that we consider everybody's mental health as important as any physical health. Like how if you have a fever or a headache, we would be happy to go and visit the neurologist or the physician. We would also have to look at mental health as equally important. If you're anxious, it is important that you look out for the mental health professional, take help, and that awareness is the first key step in helping yourself. So when we ask, would you be asking me questions, or I will continue?
We can do it either way. Maybe we can have a little bit of insights from you on general coping strategies, and then we will come to some specifics, and we'll also take some questions from our audience.
All right. So thank you for that. So when we discuss about psychological health, there are 3 A's which we predominantly talk about. So the first one, which I just said now, is the awareness phase. So only when people know that this is my anxiety, or this is a panic which I'm going through, I am feeling sad, am I getting into a depressive episode, or am I feeling isolated? So many times what happens is, when we are able to understand the feeling, so what happens is, when you are aware of this as an emotion, as a panic, or as an anxiety or a depressive episode, then it becomes easier for people to go and take help for that. So the first A is awareness. The second A is acknowledge that, okay, I am going through something like this and I need to work on it, rather than dismiss it off. This also is very important when it comes to family members, friends, and colleagues, because many times what happens is, even if the individual is aware that, okay, I am getting panicky about, being isolated, or about my financial status, or whether I will be able to continue my job, many of the other people who work along easily discount it, saying, you don't need to worry about it. What is the big deal about it? It's just an anxiety. No, please acknowledge it. It is very, very important. And then when we move on to the action phase of, either do self-help, you could, look at yoga and breathing exercises, mindfulness. We have a lot of it in the Indian spiritual system itself. Or if you think that the anxieties and the panic are too much and you need a mental health professional to help you, yes, of course, we are there to support you. So that comes in the action phase. So only when you are aware, you acknowledge, and then move on to the action phase, what happens is, the prognosis is better, the recovery is better. And we also understand, in a recent study, I was just reading through the recent studies, we understand that the factors which support prognosis better, factors which help people to improve better, one is definitely social support. We understand that we are in a phase where we should not be looking at others, we should not even handshake, we should not smile, and the mask covers it all. So we only can see the other person smiling through the eyes, and that many times can make us feel isolated.
Yeah, absolutely. Yes.
So many times it's very difficult, because we are an open society. We are so used to, warm hugs and, being together. And a small birthday party can never be just father, mother, and child. It is always so many people around, when we are missing all that. So what we see is that social isolation has greatly influenced people getting into panic mode, because one, they would want to meet up with friends. Two, they're anxious if, they can be infected by being with a family or friend. So either way, it's a double-edged. So one side you want to meet up, one side you are scared whether you would get infected. So what we usually advise people or suggest is that, see, COVID has asked us to socially isolate, not emotionally isolate. You can still have your Zoom meetings, or you can still, stand on the balcony and meet up with the neighbor, or, go on walk where it is a safe place where you are having social distancing, but you could still see the other person with your mask on and have your sanitizer on. So nobody is asking you to totally sit inside the room, lock up yourself. You are allowed these kind of, moving out and meeting up people, either virtually or in physical, but of course, maintaining the distance. That social support is definitely going to help you understand that you are not in a lockup situation. You are not in a jail unless you are in quarantine. Even in quarantine, we do suggest people that you at least have your virtual meetings so that you don't feel isolated. What we've seen is, people in isolation, the number of depression goes up, because they feel, oh, I am physically unwell, And added to it, I am also socially isolated. Nobody is there to support me. And the mind, is the Pandora's box, and it adds to the loops of thoughts. And then one thought leads to the other. And finally, we end up as in, this is the worst part of my life. And that definitely adds on to, being more sad, depressed. And there are a lot of people calling up for, looking help for self-harm. So we've also seen the number of, adults and adolescents and younger adults talking about self-harm. So that's also something which we need to acknowledge. If somebody is calling you, saying that they are depressed and they are looking at ending their life, please take them seriously and reach out to them. That one call and that one statement of I am here to help you, I am there with you. It's a very simple statement. I am here to help you. Call me when you want, is a very strong message to that person who is in the house or in quarantine or anywhere in the world where he or she thinks he's alone. And that simple statement has, many people have told me that simple statement has stopped me from hurting myself. And that was a wow for me, because it is just a split second decision which people can make. Similarly, we also see many special kids who need a lot of time and space and scheduling, and they find it very difficult. I really empathize with parents who have special kids and the special kids themselves, because many times it becomes very difficult for parents to teach them in class, support the child, and if the child needs more intensive sensory integration therapies or speech therapies, occupational therapy, it becomes very difficult for the therapist and the parent and the child to work together. So many times what we say is try and be patient and friendly with the child so that the child also understands. And many children do understand when we have not a rigorous kind of time schedule, have a flexible time schedule where you also allow the child playtime. The child may not be allowed to go out and play, but of course you can have a small area in the house, maybe in the bedroom, maybe on the side of the living room, that the child has me time there, maybe with the parent or maybe alone. So this definitely allows the child to have a schedule where child knows this is the time for studying, this is the time for playing, this is the time I have for TV. And this definitely works well even with any child. Now, so what happens is, if there is a schedule, like how in 2018, 19, and before that, we had 9 o'clock classes would start, so 8 o'clock the school, so the child needs to go to school, 7 o'clock the child needs to wake up. So there was a schedule there. Now the sleeping is at 1 a.m., getting up is God only knows when, and that sleep cycle itself is contributing to a lot of issues, especially when it comes to mental health. And again, obesity is in the rise, because one is definitely the sleep cycle going bizarre, parents sleeping late, watching Netflix late, children equally getting into social media and sleeping later and later. Now the days have become the nights and the nights have become the days. And that again affects the circadian rhythm, which influences the depression again, or the anxieties again. So it is very mandatory that we have a sleep cycle, we follow it, whatever you go out and work, or you are staying at home and working or attending class, your sleep cycle has to be regular. That also ensures that your eating habits are regular. So you have your breakfast, lunch, and dinner almost at similar timings. And no eating, snacking in between, no swiggying too much. So that again adds on to the obesity.
But doctor, do you think that COVID-19, yes, because of the pandemic, there are so many mental health issues. But what about the virus itself? Is it likely to, cause any kind of mental imbalances in a person who has got COVID-19? Because we do hear of people becoming, I mean, we know that in post-viral, there is an element of depression, but does COVID-19 particularly cause these kind of things?
We are not very clear about whether there is 100% ratio of, if you are COVID-19 infected, you will definitely get into depression. What the study says, recently Lancet, the study, what I was reading up, shows that the chances of a person going into depression, one is, of course, if there is a previous history of depression, or if there is a lack of social support, a lack of financial resources, and a lack of basic amenities. So that all that are precipitating agents. So if all these agents are also working on the person, then you have 100% chance. But there is no linear equation saying, all COVID infected people will need to be depressed or, getting into a psychotic episode.
It's probably also their exhaustion and generally, sometimes when you have feared getting something so much and when you come out of it, perhaps it's that
Yes,
as well.
yes. It's like seeing the monster and saying hello and coming back.
Yeah. In fact, some people have told me that, they were so worried about getting it when they actually tested positive. It was as if like, one fear had gone out, like now I have got it. So, yeah.
That's exactly what a teenager told me, that, she was worried, and then it was like as if going into the monsters world and coming back.
Out, yes. But what would you, do you think that, the inordinate, how do you differentiate really between somebody who is normally a little scared about getting the infection, or when does it get into absolute panic, and what are the health repercussions of extreme panic? Does that itself cause any other complications or health issues?
Yes, especially with COVID related aspects, because we know the respiratory system gets affected, and people do have lung infections and dyspnea and difficulty in breathing and all that. So many times what happens is it can mimic a panic attack. So in panic attack, you do have hyperventilation, difficulty in breathing. So people with anxiety can have panic attacks, which they think could be a COVID related infection. And there also people, because of the hypervigilance, they keep checking on, latest news on what could be the new symptoms, like the black fungus which came. There were people calling up just to check. It is nothing to do with any fungal infection, nothing. But the heightened hypervigilance adds on to the anxiety. So what happens is a panic attack, which could be, eased out with a breathing exercise. What happens is that kind of translates into this person thinking, I'm COVID positive now. And then that adds on to the anxiety of the whole family, as in, now I need to isolate, I need to take him to or take her to the hospital, and that the link goes on and on.
So what should we do to avoid this kind of thing? Like, let us first talk about this non-COVID but fear. What would you say, like, what should they do to make sure that they're not overreacting, as you said, this
So the most important aspect, what we call, is called the information diet. So like how we would not binge eat, or we would not eat over this thing, we would prefer having healthy meals. Similarly, we have an information diet, as in read at things which are from authentic sites. So, don't believe just a WhatsApp forward or something which come randomly on the Google or Wikipedia. See whether it is from an authentic site. And then look at, are you hyper vigilant about yourself? Are you looking at each and every symptom? If I didn't sleep maybe half an hour, that's okay. So what? You can sleep more or less in some days, or you don't feel the appetite once in a while. That's fine. But once you start connecting every symptom, then it starts becoming that, yes, I think, I need to get into a consultation. I am sure I'm getting into a positive mode. So we need to be understanding that being hypervigilant is definitely not helping you in any way, and you need to have information diet here.
So if one does get a panic attack, how does one, actually ease out of it?
So of course, the medication part is there. For that, you will need to meet the mental health professional. You can't be self-medicating. That is very, very important. Over-the-counter medications, definitely no, because that you have other difficulties because of self-medication. Best would be to practice the Indian system, maybe yoga or deep breathing, or different asanas or mindfulness, which you can download. There are a lot of apps like Headspace, Smiling Mind, which is easy, free downloads, and they give you breathing exercises. So they have breathing exercises from 30 seconds to almost like 2 hours. So 30 seconds, anybody can take that 30 second in their 24-hour schedule and do that. And 30 seconds 4 times a day. Wow, that is hardly maybe 1 minute plus. But that is what is helping you to keep your lungs and your respiratory system better, plus providing the emotional peace which you require so much, because you also understand how the emotional aspects, the anxieties would influence your immune system. So, you understand that we all know about the corticosteroids with the stress hormones, which increase when the person has anxiety. So we need to bring it down by, how do we bring it down? Improving the happy hormones, the endorphins and the oxytocin. How do we do that? One is definitely with physical exercise, the yoga, breathing, mindfulness, not socially isolating, emotionally connecting with people. So I usually tell people, call up, write a letter, send it as WhatsApp, something which allows you to connect with your group. Yeah. And anything which helps you to have a routine in the daily schedule. Have time away from COVID-19 conversations. There are so many things happening which are, good things happening in this world, right? Talk about it. Understand that COVID-19 is just a part of our world. There are so many good things which are happening, and come down to your value system. So if your value system is to help people, go. Even helping doesn't mean you have to spend like 1 lakh on the relief fund. Even if you give food to your watchman or somebody sitting on the road, that is your value system supporting you to make you feel happy. And that endorphin is definitely going to help you feel better. And that way you're making two people happy. The other person who gets the food and you as well.
Next is somebody actually gets COVID. So could you tell us, right from the time when they test positive, those 10 days are actually very stressful in everybody's COVID-19 experience, because they say like, you have to wait for day 4, day 5, day 6, you're monitoring your saturation minute to minute, probably doing it all yourself, nobody's around you. And at any minute you think that your saturation will fall. And it has happened also when people have to suddenly go to the hospital. So it's all very, very difficult to deal with, because we are not used to, because we have our family around us when we're sick, and we are much more, and we also now had the situation of oxygen and bed shortages. So, it's like a really stressful situation. So what does one do when, they've tested positive? How can they keep themselves mentally calm and, go through that whole rather traumatic experience with a very cool head?
Yeah. Thank you for that question. Very pertinent question, Dr. Srinidhi. It is important for all of us to understand that COVID is here and we have to face it. So it's not necessary that I should get it. Anybody from my family can get it, or even, I can get it. So we need to be first open that, we need to be careful to be wearing all our the mask and the sanitization and the PPEs whenever is necessary. So we are preventing as much as possible. Even after all that, suppose somebody from the family or you yourself get infected, it is also important that we are not rigid about it. We have to have an open mind regarding, okay, now I've got it, what do I do about it? Like, for example, if you are going for a holiday, and on the way, this is in 2018-19, not now. On the way, if your car had a puncture or the flight is cancelled, would you stop the holiday, or would you look at something else? Change the car or book some other flight or take another train, whatever it is possible, so that we get to this, the destination. Same way, our destination is mental peace, being healthy physically. So now there is a break in your journey. That is the COVID infection. So what do? You don't stop with everything. You understand that there is a pause here. Now, what do I do to get back into my destination of mental peace and physically being healthy? I still continue with my routine schedule, eat on time, sleep on time, have, activities which help me to take care of my mental peace, also socially connect, and of course take care of your saturation levels. And so keep yourself busy even though you are socially isolated. And social isolation doesn't mean you are locked up inside a cell. You can still virtually or through the window meet up other people. And that is definitely going to help you. And after the post-COVID also, it is very essential that we continue doing this routine and not suddenly stopping. I've seen many kids. My daughter had COVID positive, and the most importantly, she used to tell me is, I am bored inside. I had not given her a gadget because I didn't want her to sit in with the iPhone and play on the phone. And then I told her, why don't you read? And that's when she went back into her books. And she said, yes. And after the COVID, she said, now don't give me the iPhone. I am happy with my books.
How nice. Yes.
Okay, so I was happy to the infection that it took us back to the books.
Reading is one big stress buster, isn't it? I think it can immediately transport you into a different world where there is no COVID and it's got different characters.
Exactly, you reach anywhere in the world.
Yes. Another thing is about after the post-COVID. Let's talk a bit more about once somebody, they might have had a very smooth recovery. They might have just been ill, but there are some people who really have a very stormy period where they go to the hospital and then from there they might have to go to the ICU. I mean, these all add to the stress, and then they come back probably needing oxygen for a long time, or not yet long COVID, where they kind of also have the exhaustion. Now, these kind of people often complain of, I'm just too tired. I mean, it's all very well to say connected and all that, but I just don't feel up to it. And many of them go into depression. So what can they do to really, or what can the family do to kind of help them heal quicker and not go into a kind of a spiraling depression? And, we have heard a couple of cases also where there were suicides during this time. And
post-COVID especially.
Yes.
Here, it is important that we understand this concept of anhedonia, where we talk about anhedonia is where we do not like pleasurable activities.
What is that, Doctor? Anhedonia.
What happens is we do not like pleasurable activities, and that is the first step of getting into a depressive phase. So what happens is, one, as I told you, you have to be aware that you can get into this phase of not being interested in activities which used to be pleasurable for you. It could be, a Game of Thrones, or a PUBG game which you used to play earlier, or if it is a senior adult, reading the newspaper. So somebody lately told me that he's a senior adult. He said, I'm just not interested in reading the newspaper. Initially, I thought, oh, it's good that he's getting into an information diet. But later, after I probed, I understood that he is just not able to focus much as well as before, not because he has a cognitive decline, it's just that he doesn't feel, he says he feels the lack of energy to it. So what we did was a behavioral experiment where we thought of, let him read only things which are interesting for him. So he is interested in sports. So he would not read the whole newspaper. He would read only the sports column bit by bit. So what happens is, when he's able to reduce and focus only on things which are interesting for him. Similarly, you can't be doing as much as work as before, and nobody can force you. Like it would have been a working mother, she who is post-COVID, and you can't expect her to immediately get back 10 days over, now get into the workspace and finish off the cooking and the cleaning because the maid is not coming. And you have to also respect their physical health as well. So the family as a unit will need to support this particular working mother, or it may be a homemaker, it may be a young adult who's working, who's an IT professional, or a senior adult, or even child. What we need to understand is, there is a chance of this person not feeling it, but that doesn't mean that you just mock the person or blame the person and making him or her feel more upset and feeling so insecure about themselves. It is a collective process where the family has to be as a unit working towards mental health. And it's not just one person's ordeal or a challenge here.
It's also sometimes people compare, they say that, oh, but somebody else had, but that's the thing about COVID, isn't it? It's so different in different people.
It is so different. It's a process, and there is absolutely no comparison.
ones who just get through it with one day of fever are the lucky ones, but
Yes,
not
yes,
everybody has
yes.
that. Also, doctor, the other thing is about people who already have some mental health issues. This is a particularly difficult time for them because uh, they have to be isolated or they can't go out. And then if they get COVID, then, it becomes even more of a worry. So how would you suggest that, families with already mentally, it might be somebody with already with Alzheimer's, or it can be a youngster with schizophrenia or depression, what will we do? I mean, how do they cope? I mean, is there anything special that they should know?
Yes, that's also a very pertinent question, because the families and the person is already going through a long-standing chronic mental illness, right? So it's important that you cannot expect the person with a severe dementia to totally understand the nuances of, prevention and social isolation. So it's also important that we try and, maybe educate the person as much as he or she can comprehend. Of course, the other family members also need to be safe in that person. So many times prevention is the most important key here. And even if the person has something, maybe schizophrenia, see to it that the medications are provided on time. Many times it can also be that the caretaker can be in isolation. So the caretaker will not be in a position to provide the medications on time. That is where the social support comes in. So find out, or at least try and see for the initial few days, that this particular person can be kept in a maybe a family member or a friend's house where the medication is given on time, where the person is allowed to sleep on time, so that the routine of that person is not affected. And this particular person who is a caregiver, who if in case if she or he is tested positive, also has the peace of mind that my son, my spouse, my brother is being taken care of.
Right. Also, the sad truth is, especially in the second wave, we have faced a lot more of families with the loss of their loved ones. So there's been like sudden deaths, and it's generally been very difficult for people to cope. So, what are the mechanisms for this kind of a grief that which suddenly comes without any warning, and also sometimes there are young children who have lost their
Yes,
parents. And so these kind of insurmountable losses need to be also coped with. So what would be your advice for that?
yes. That's an important question too, because see, death is something which is inevitable. All of us know. However, we definitely don't talk about death and dying. We are always, trying to push it away and not discuss about it. So the most important thing we need to understand is Kubler-Ross has given, she's a psychiatrist, who's given the stages of bereavement. And what she says is the first stage is denial, where people are just going numb. They know that this person can die or get into a coma or needs to be on ventilator for long, but there is still that disbelief. And then denial, anger, bargaining, depression, and acceptance. So it's DABDA, but it need not be always in the same linear fashion which it goes. So what happens is people have to go through these phases for them to also feel that acceptance of grief. And as we all know, if we are born, we will die, and there is no other choice for them, right? Unfortunately, we don't talk about death and dying, and we definitely don't want to talk about it. But it is essential, especially in the COVID time, that we understand that that's going to be part of our life. And that understanding is also helping us to go through these phases. And now David Kessler has added one more, he's a psychologist who's working on death and dying, one more phase to it, which says meaning, which is really very important aspect, where after you accept that this has happened, I've lost somebody who's very close to me. It could be your spouse, it could be a child, it could be a sibling, it could be a very close friend. And what happens is that is the acceptance, moving on to the finding meaning to your life. So instead of thinking of that person with pain, you are thinking of that person with love. So you are evolving yourself. And maybe if you think that, that person would have been very happy if you do this in life. If my brother wanted me to, be a good doctor, if my father wanted me to be completing my PhD, or if my father wanted me to do something like this, let us take that as a meaning and move around that. Yeah. And so what David Kessler says is that instead of thinking of this person with pain and regret, think of this person who is not there physically with you. He or she is with you in your mind, in your memories, with your soul, and with love. When you look at all these memories, that person is going to live with you.
Right.
And that provides a lot of mental peace to people who are living in this world now.
Absolutely. Now I think we will look at some questions which are coming live to us. But before that, I also wanted to ask you, what kind of, if somebody requires to reach out for counseling or emergency psychosocial support or psychological support, do we have any kind of a helpline with us where they can contact us?
Yes.
So that
So Apollo provides the Apollo 24/7 services. There is also this the Indian Association of Clinical Psychologists, which has a free counseling service called the Paramarsh, which is available online. So if you look at Indian Clinical Psychologist Paramarsh, you get clinical psychologists throughout India who would provide this support service free of cost on any language. So it need not be only Tamil or Malayalam or English. It can be any language spoken in India.
Right. So now we will take some of the questions. I'm constantly worried about my post-COVID recovery. Are there any tests that I can get done to check impact on my body? It's not exactly a mental health question, but I would think that they should probably, they have to give their bodies enough time to heal, but because later on many people go for a health checkup, or some people do an echo, or I think it's best to ask your treating doctor as to what kind of test do you need, because obsessively checking for hemoglobin or CRP levels or even testing for antibodies is not required. I think what they should listen to their body and take advice on, depending on the severity of their COVID, take the appropriate advice on what they might need to do. And if that makes them feel any better mentally, I think, a lot of people after 6 months or so do a complete health check, which puts their minds at rest.
Yes.
So that is that. Another question is, I'm unable to sleep properly post recovery from COVID. What should I do?
Yes, that's also a symptom which we are seeing very commonly, and it's also given in the literature. Sleep and appetite, because you can have taste and smell deficits also. So sleep, don't worry about the sleep. So if you're worried, your brain is active, and you're definitely not going to worry. I mean, not going to sleep if you're worried. So it's better to be, not going behind the sleep saying, I'm not sleeping, why am I not sleeping? Instead of that, maybe, keep some music, and of course do your walking exercise, keep yourself physically active, so that end of the day, at least whatever time you sleep, 10, 10:30, 11, not beyond 12, 1 and all that. So that, again, the circadian rhythm just doesn't get malfunctioning. If you have a routine there, and, most importantly, don't worry about not sleeping enough. Your body knows how much to sleep. It will get back into the rhythm once you allow the body to relax and calm down, and allow the mind to calm down. So keep soothing music, listen to whatever you like. Don't keep too many gadgets around, so that, the beep of the mobile wakes you up. Don't keep the TV on. So please look at sleep hygiene. It is available online. So what you need to eat, how you need to keep the environment around you, what you need to avoid before sleeping, so that, your sleep hygiene is good and your sleep quality is good. So if you can Google that, it's called sleep hygiene. It allows you to get more tips on how to improve your sleep. And most importantly, don't worry about the sleep.
This is another question. What are the symptoms of anxiety?
Okay, that's a very commonly asked question.
Yeah.
See, what happens is anxiety is not just worry. Anxiety has physical aspects that is on the body. You can have a racing heart, you can have dryness of throat, you can have dizziness. You can have emotional aspects that is worrying, uneasiness. You can have cognitive aspects that is, am I going to die? Am I COVID positive? What will happen to my children? It can also be behavioral. So, pacing up and down, not able to sit in one place or shouting. So you need to understand that anxiety is all of these, the physical aspects, cognitive aspects, emotional aspects, and behavioral aspects. And just because you got anxious once in a while, that doesn't warrant you into being an anxious or an anxiety disorder. You are just anxious at that phase. And if that continues pervasively for a long time, according to the guidelines, for about 2 weeks, then you will have to see a mental health professional.
This is the last question. How can students focus on their studies? Now, this is a common question because I think on one hand, one has to get on with further studies, qualifications, but at the same time, exams are being cancelled. So, but then there are some which are happening. So, what is your advice really for students?
Very important question too. See, what happens with students is, especially in our country, more the students are anxious, the parents are anxious, the grandparents are anxious, the whole community is anxious about it. The 10th standard boards, the 12th standard boards, engineering results, all of that. So first thing what we need to understand is that if you're studying, you will have exams and it is mandatory. So, exams are going to be here. Maybe they would cancel one or two exams, but they would still continue having exams. So, when you are focusing on your online classes, see to it that there are not much of disturbance around. So, even if you cannot have a room for yourself, if you can have a corner in your room where you're facing the wall and you're not getting distracted so much, and see to it that the TV is not very high volume on the other room, or there are not too many distractions around, so that you are able to focus, and preferably with the video on. Many times what happens is when the video is off, you think that the teacher cannot see you, and that in your mind can make you feel that anyway teacher can't see me, so I can Google, or I can look at my messages or look at my Insta, which again is distraction. So it's only for a few hours where you have your classes. So most importantly, keep the distractions off. Sit in a corner where you do not have much distractions. Switch off your all the other gadgets other than the gadget you are using to attend class, so that you have enough time and no other distractions, focusing on what is necessary. And sit in a place where the chair is comfortable and not on the bed, whereas when you sit on the bed and you have a tendency to keep leaning and then you eventually sleep off. So sit on a chair, so that you, even if you want to stretch yourself, you can always move the phone or the laptop and stretch, but not on the bed. So these are environmental aspects which you need to take care. And most importantly, worry is definitely not going to help you. Understand that by worrying, you are only reducing your capacity to concentrate. So do not allow the worry to overpower you. Be aware that worry is just part of you, and you have the control over worry.
That was a wonderful session, Dr. Kirti Pai. I'm sure there are much more questions, and there are mental health, as we said, is a long and vast topic. But I do hope that our viewers, if there is any requirement, will reach out to us through our 24/7 app, and several of our psychologists, experts like you are available and can be contacted. And I think I would also like to stress that it is important to acknowledge that these issues exist. Acceptance is important, and only then can they be resolved. No point in sweeping it under the carpet and trying to be in denial. The next session is on 15th June, that is the coming Tuesday at 2 o'clock. It's going to be about managing gastrointestinal issues post-COVID-19 infection. And Dr. Piramanayagam from Apollo Hospitals, Chennai, senior medical gastroenterologist, is going to talk to us. So please join in. And also please subscribe to our YouTube channel to get all the latest information and see all these videos of the many conversations that we have had over the last 2 months almost on various topics related to COVID. If you have more queries also, please reach out to us through our messenger or through the comment section. Take care, and though COVID cases are declining, please don't forget our SMS, which is the social distancing, wearing the mask and sanitizing always. Thank you and namaste.
Thank you very much.